Welcome back to TV5 News at 9. It's now time for Medical Moments with Covenant Healthcare. This week is National Physicians Assistants Week, and we are celebrating the work they do for their patients. Joining us now this morning is Physician Assistant Mark Thompson and Dr. Frank Shinko. Thank you guys so much for being here. Tell me a little bit about the work you both do.
Well, certainly, we are running a service, a neurosurgery service at Covenant Healthcare. We have a robust service both in trauma, adult and pediatric neurosurgery, and we have some excellent physician assistants and advanced practice providers that help us do that work.
So you guys both collaboratively work together as APA neurosurgeon team. Mark, what does a physician's assistant do, if you could break that down for us?
Yeah, so a PA is a physician assistant, and we're trained in the medical model. So we train alongside in our education with actually medical students. I went to Wayne State down in Detroit, and the difference is our training is a little shorter, 2 to 3 years depending on the program. Whereas physicians, after they're done with their training in school, they go on to a residency program. PAs, you're kind of trained as a generalist. So once you're done, you go into your said specialty. But PAs are licensed clinicians. We practice in every field, specialty. And I just chose neurosurgery to work alongside this guy, who has trained me well for almost the last 10 years.
Right, and Dr. Shinko, having a PA is valuable. In what ways does it help you provide your patient's care?
Well, basically it extends our services. Certainly we can't be at every place at every time. So if I'm doing surgery in the operating room or seeing patients in our clinic office and their emergency comes in, certainly we need help with to take the breadth of care to provide good care for the patients in a timely fashion.
Right. And Mark, if someone wants to be a PA, what kind of education do they need, and do you have any advice for them?
Yeah, so the training is pretty extensive, but you have to go do undergrad, you have to have a bachelor's degree, and after that you apply to the program. You generally need some training in the medical field prior to getting in, called patient hours, and study up on your anatomy, all your sciences, prerequisites. But I would say most of the undergrad programs at any college university has pre-PA programs that you can be a part of and learn more about the field and getting into it.
And this is really a question for both of you. How are you celebrating PA Week, and what do you want PAs to know as we celebrate this week?
Well, I certainly want the PAs to know that they're a valuable portion of the medical team. We can't really do the work in the breadth of care, especially at Covenant, without the assistance of our advanced practice providers and PAs.
Mark, can you tell us why you love what you do?
Yeah, I think it's the access to the patients being available not only with our physicians, but extending the efficiency and accessibility to our patient population, so they are able to receive care in a timely manner, but also get quality care, extraordinary care, as we say at Covenant, with our patient population.
Of course. And is there anything you guys want the public to know as we celebrate our physicians' assistants this week?
Well, certainly, again, the PAs, the physician assistants, are an important part of care. They extend our physician abilities to take care of the patients and provide the care that they need.
Of course. Well, thank you guys both again so much for being with us this morning. If you would like any additional information on today's topic, just head over to the hot link section on our website at WNEM.com.